Thank you for joining today's webinar, Financial Freedom to Build Better Community Health. If you have questions, please enter them in the Q&A panel located on your WebEx screen. We will answer all questions at the end of today's session. Today's session is being recorded, and you will receive a recording of the webinar in a couple days. Today's speakers include Tracy Cloud, Chief Executive Officer of Lower Lights Christian Health Center. Tracy is passionate about providing underserved individuals with access to high-quality health care. She has 2 decades of experience administering government-funded health care programs and now serves as CEO at Lower Lights Christian Health Center, an FQHC located in Central Ohio. We are also joined by Kevin Fleck, CFO with Lower Lights Christian Health Center. Kevin is responsible for accounting, financial reporting, and revenue cycle management at Lower Lights Christian Health Center, where he has served as Chief Financial Officer since 2018. He has more than 20 years of experience in healthcare finance and earned an MBA from Wright State University. We are also joined by Julie Amon, RCM Client Director with NextGen Healthcare, and Sean Gurry, Financial Solutions Director, also with NextGen Healthcare. Sean, with that, I'll pass it over to you.
Don't mind, and maybe you could share a little bit about the Lower Lights mission, what you're trying to do for the community, and how you go about and approach that within the community.
Sean, I'd be happy to. So at Lower Lights, we serve over 12,000 patients around Central Ohio, and our mission is to provide quality, high-quality, whole-person care to anyone who needs it in Central Ohio, regardless of their ability to pay. And the way we look at whole-person care is we provide primary care as well as behavioral health care and even spiritual care. So some of those services, in addition to primary care and behavioral health care, we have an on-site 340B pharmacy. We provide dental and vision services. We have a dietitian on staff, provide prenatal care, and food prescription program as well.
Okay. And size and footprint-wise for Lower Lights within the Greater Columbus area, can you go into that a little bit?
Yeah. So our offices, and we have a big presence here on the west side of Columbus. If you're familiar with Columbus, we have 2 locations in Franklinton, so we serve a lot of the Hilltop as well there. We have a couple other locations around Central Ohio and Columbus in particular, in Linden, as well as on South High Street in German Village. And then we also serve Union County, which is more rural. And we opened a new site in Licking County, also more rural area. So we have a real interesting rural-urban mix between all 7 of our sites.
Okay. And how long have you been partnering with NextGen holistically from start to today?
So I came aboard in 2017, and we have been with NextGen since then, and I believe at least a few years prior to that as well. That has been, I believe, our only electronic health record system that we've used in our history. I believe we converted to NextGen from paper quite a while ago.
Okay. All right. And, you know, coming up next is something I'm very preferential towards, and I've shared with a lot of different FQs across the country. And it does wrap in really, really nicely to the whole person and the whole family care aspect of what Lower Lights is doing in the community. Can you share a little bit about why I carry these pictures on my phone and what they actually mean?
Yeah, so one of the things that makes this unique is our nonprofit grocery store and cafe, which we opened in 2018, in May of 2018. And it serves a community here on the west side of Columbus where there's not a whole lot of access to grocery stores, especially places where community residents can buy produce and healthy foods. So primarily what's available to them, or what was available prior to the Jubilee Market and Cafe, was really gas stations, corner stores, and fast food places. So this is really providing an alternative to the residents of Franklinton and the surrounding areas. Access to fresh fruits and vegetables, it's a full service grocery store. And then we have an excellent cafe as well, which is a great place to really build community, provide a place for people in the community to come together. Our patients use it, eat there, our employees use it, as well as just folks living and working in the area. So it's been a great spot to build community. And with that, we've cultivated and received some grant dollars, so we are able to offer a food prescription program through the market as well, which has been a real benefit, especially to families that are dealing with food insecurity, and also the adults that we're serving with chronic conditions.
I just love how it ties back to the education in school and community with children about healthy eating and healthy habits, and now enabling them to have access to execute on that education. It's always hit a nice spot for me in my heart for some reason.
Yeah, and it's great because we pair up nutrition education with access. So it's not, a lot of times you do one or the other, but not necessarily both. So the great thing is our dietitian can actually walk people through the market and educate them on how to read labels, and talk to them about different healthy recipes. As a part of the Food RX program, we do a meal kit every month for our families and our individuals. If you're familiar with things like Blue Apron or HelloFresh, it's our version of that, in addition to the gift card they receive in the nutrition education. So it's real comprehensive.
Well, thank you for sharing that story. I tell it just about every FQ and non-FQ that I go and visit with. It's just near and dear. I know we're talking about financials today and financial outcomes and financial empowerment. From your perspective as CEO, do you want to give an overview of the financial life cycle of where Lower Lights has been and where we are today from your perspective?
Yeah, I'd be happy to. So I became CEO in 2018, and we were struggling then with accounts receivable. We were struggling to really maintain a billing team with the right leadership, the right skills and abilities. It was, difficult to find that, to hire that. We had quite a bit of turnover, and, we struggled with that for some time. We made progress here and there. We ended up, having a couple different CFOs before Kevin came aboard and helped us really stabilize. So I have to tell you that was one of the areas we were struggling in, even a couple years back, and had tried many different things to be successful. And with the pandemic, things really kind of fell apart for us in terms of just accounts receivable building to a place that we weren't comfortable with, and we knew we had to really make a change and do something a little more dramatic than what we had been trying.
Yeah. And you actually took a rather traditional approach to engaging with NextGen on financial solutions, more of a two-step type of model, from temporary to RCM. Even though I tried to stalk quite a bit and I was present quite a bit, what led you down that road, and why are you happy with the way you approached it?
Yeah, so as I mentioned, we were not in a good place, and we kind of came at it from two different angles, and frankly felt like we had to. Our first step was engaging NextGen with some supplemental help, I'll call it, to kind of supplement our team and help us figure out some of the claims denials that we were receiving, and just helping us submit claims adjustments. Really, it was more about stopping the bleeding, if you will, than anything else. And so we had a good experience there with NextGen, and we were really happy with the expertise that we received through that process. But it wasn't enough. We still needed more, and we needed a different solution. And frankly, we were growing to a place where we needed more. It wasn't just about manpower, but it was about more sophisticated tools as well. So that's when we took the next step, which was to reach out and ask for help with the revenue cycle management in a much more comprehensive way than just, a couple of resources to help us manage our AR. So we maintain the help with the AR during the implementation period, and we're still utilizing a little bit of that now. But I think we really needed to approach things from both angles to get where we are today, and in a much, much better place.
Great, thank you, Tracy. And that much, much better place, NextGen prides itself on being a trusted advisor and a partner to our customers and helping you realize better, not just believe in better, but realize better. What have you been able to achieve or plan for the future now that you have this partnership in place?
Yeah, well, I will let Kevin talk a little bit more about the specific metrics where we saw a lot of movement. But from my perspective, number one, as a CEO, I'm accountable for the financial performance of our organization. And that, of course, drives our mission, right? So I'm accountable to the board. We have more transparency now that we're in a place where we can answer questions that the board has. Maybe we didn't have the right reporting to do so in the past. And of course, because we're in a better financial position, our mission is secure, and it allows us to provide some of the services that you don't necessarily support through traditional sources of revenue, like claims. For example, in Ohio anyway, dental is an area that FQHCs aren't making money on, typically. And things like our nonprofit grocery store and cafe. So being in a financially stable and positive place allows us to support other lines of business that we wouldn't necessarily be able to support otherwise.
Okay. All right. And as we move forward, Kevin, you and I have had the opportunity to get to know each other over pretty much the last 3.5 years. And we went through some of the challenges that you had. Maybe you'd like to share a little bit about your role, you joining Lower Lights, what you came into and where you are today a little bit?
Sure. Yeah, so I came to Lower Lights in 2018, and it was, as I like to say, it was a little bit of a cleanup job. When I came in, Tracy kind of alluded to, we had some turnover in the finance area, finance and billing staff, and just, things kind of needed to be caught up, cleaned up, so forth. And so we really spent a lot of time on that, especially through, calendar year 2019, really just sort of stabilizing the finance piece of the organization and getting some good staff in place and so forth. And we made a lot of progress. However, we did continue to have some struggles, particularly around billing and collections, throughout 2019 and then early 2020. And as Sean mentioned, we'd had several conversations with NextGen about, what they might be able to offer and what to do. We did engage, the additional assistance, staff augmentation project, sort of, I guess, phase one, if you will. And then specifically, when COVID hit, starting around April or May of 2020, and then through the rest of that year, collections really dropped off and outstanding AR just continued to grow. And so that's, it's kind of the old cliche. You can't just keep trying to do the same thing and expect different results.
And different results is kind of a nice transition. So, the different results that you were looking to achieve and the metrics or benchmarks or KPIs that you use to measure those, or maybe share some of the technologies or solutions that you decided to leverage to get you where you wanted to go, Kevin?
Sure. Yeah, so One of the first things that I always looked at, even kind of before and after, is what does monthly collections look like? What is total outstanding AR? And those are kind of the two easy ones. But specifically since moving to partnering with NextGen for RCM, we got access to a financial analytics tool, and we can just see a lot more and have a lot more visibility of what's going on, and it's real time. This is almost the end of the month, so this morning I popped in there and looked at what does the month of October look like. We don't have to wait until the reports are run at the end of the month and so forth. So there are additional things like days in AR, lag time from the date of service until the claim goes out the door, or from the date of service until we get paid. So those are some additional things that we can look at. And then benchmarks. Before we started doing this, it was fairly often that we were kind of sitting here saying, well, what are other FQHCs doing, or what's really the right target number for this KPI? And a lot of times we weren't really sure. Now we have a group that's specifically has community health center expertise, and they can tell us, well, this is where you guys are, and this is how you compare to other similar organizations, and that's extremely helpful.
Right. Now, one thing I stressed with you from the beginning, and hopefully you'll agree with me at this point, otherwise it's a very silly question for me to ask. I've always said that NextGen, especially with the financial solutions and revenue cycle, wants to partner with our customers and empower our customers, enable you to focus on other areas. Have you been able to take your existing staff and have them support physicians differently or patients differently? And would you agree with the statement that we came in as a partner as opposed to more of a traditional outsource?
Yeah, definitely. And we were,
Thank you.
Yes, Sean and Tracy and I, and we were pretty upfront and frank in our early conversations. And one of the things that we at Lower Lights didn't want to have to do is kind of outsource, so to speak, specifically to go to our staff and say, I'm sorry, but we're eliminating your position because we're going in this new direction. So that, we just felt like that's not who we are. That's not part of our mission and what we want to do. And so really, talking about it being a partnership was really not just a quote unquote sales conversation. I mean, it's a reality. We do still have most of our billing staff. We did have one person resign that we didn't need to replace. But Sean kind of alluded to this there. Their roles have changed. They're not spending all of this time chasing denials, manually posting payments, doing some of these other things that were really kind of time drains for them. And one example of what we're able to do for our patients now is we have one person who's specifically dedicated to eligibility and helping people apply for Medicaid and getting coverage, which it's great. It helps the patient and it helps us. The person can get services covered, medical, dental, vision, prescriptions is a big one. And then, of course, it helps us because we just flipped someone from being self-pay to Medicaid. So those are kind of some of those almost intangible things, but we're starting to see the reality of that now.
Okay. And then one other question, Kevin, I would ask is, when you're coming to a business decision or you need additional data, or you're looking for things that aren't within the standard stack of KPIs, what is that dynamic like working with Julie and Julie's team when you need additional information or you need additional support?
Yeah, so that's a great question. We have regular meetings, Tracy and I and Julie, where we review some of our KPIs, and we're able to kind of dig in a little bit deeper into sort of more of the weeds if we need to say, you know, why is this happening, or are we heading in the right direction? Those kinds of things. There's a you know, a set of standard reports that monthly the NextGen produces for us, but we can also kind of drill down into specific areas. I mentioned lag time a while ago. That's one example of where, you know, we noticed that there was, at one point, you know, there was kind of this delay between the data service and when the charges got finalized, and that really helped us identify that and kind of trace that back to what's the root cause of that and why is that happening. And you know, root cause is something that Tracy and I, that's a phrase we've used a lot, had a lot of conversations about as we try to figure out what's the next step of what else, you know, what else do we need to uncover and try to fix. And so throughout this process, you know, it really has been a good partnership and helped us identify those kinds of things.
And Sean, I could elaborate that on just a little bit with your question on some of the metrics that we follow. We're looking on a regular basis at days in AR, insurance days in AR. Kevin mentioned the lag, and we looked at that from the side of how long does it take us to get charges in, but also about our payer response and is that timely. We're looking at ways we can utilize the rules engine. That was one piece of technology that it has been very useful when Kevin referred to them being able to use staff for different purposes like eligibility. We've been able to lift some of those more manual tasks and make them automated, which has really helped get those claims out clean the first time with what the payer is expecting. So those are a few of the metrics, and we've seen steady cash increase month over month as kind of a new cash norm, as well as days in AR and insurance days in AR drop by weeks.
Yeah, and thank you, Julie. And I would say it once, I'll say it 100 times, cash is always king. Kevin, you know what I'm going to ask you. Where are you now with where you were to where you are? Are you in a better place now? Is it more easy to see? I mean, what's your level set now?
Yeah, so we're in a much better place. It is easy to see, you know, as I mentioned, being able to just go right in and see real time where we are in the middle of the month or kind of whenever I need to, but then also just where are we today? So just to kind of give you an idea, percentage-wise, our average monthly collections since we went live with our CM has increased about 25% per month. And I know that, you know, organizations are different sizes. So for us, that means approximately $100,000 a month increasing in where our average collections are this year versus last year. So it's been a, you know, very big difference.
And that goes a long way to help cover more lives and provide more whole person care within the community too. And at the end of the day, that's really the mission we're trying to enable. Yes. Lori, at this point, I want to be respectful of everyone's time, especially Tracy, Kevin, Julie, and all. Are there any questions that you would like us to address from the audience?
Yes, it looks like we do have one question that came in so far. So if you guys have any questions, please feel free to put them in the Q&A. We'll start with this one. What steps were taken to improve provider and staff workflow to complete charting and submit codes on time?
That's a good one. So we've, I guess a couple things. I mean, one thing that we started doing and we're still doing is our billing team is helping me and like our medical director keep track of charges that are still outstanding. So for us, the standard is the provider sees a patient and they have 3 days to finalize that chart and submit their charges. So the billing team is, they're right on top of that to be able to say, okay, these encounters are still outstanding, and we're working through how to get that to the providers in a very kind of straightforward and summarized way, to help that flow, and also help them with what might they need to do differently, or if there's some education that needs to be done, because maybe you've got a couple of providers that are doing something differently than everybody else. So we've been able to work through a lot of those kinds of details, and even as Sean kind of mentioned earlier, our staff, now having time to really get into some of those specifics, whereas before we were kind of so focused on the immediate fire and figuring out why things were denied and so forth. We've been able to really kind of focus on more of those kinds of things.
Great, thank you for that answer. We have another question. How are your reports generated? How are your AR reports generated? Through NextGen, or do you use another analytics software?
We don't use another analytics software, at least on the AR side. We have some memorized reports within NextGen. We also have, I mentioned, the analytics tool and kind of the standard monthly reports that we get through RCM. So we get that out of NextGen. Our quality team uses another tool, but that's kind of a different, going in a little bit of a different direction. So at least from my perspective, it all comes out of NextGen.
Perfect, thank you. We'll go with one more question. Can you just tell us about any top lessons learned from understanding your practice's financial health?
Well, I would say I don't have any regrets about making the transition to RCM and engaging them, other than possibly that we didn't do it sooner. But to really be able to, again, it sounds like kind of cliche, and I know I've already said it, but do something different than keep trying to do the same thing and expecting different results. In some cases, we didn't know what we didn't know. And so, we have a team that's obviously they're going to be experts in the NextGen software. They're also, specifically dedicated to community health centers as a specialty group, which is one of their largest specialty groups. So it's really helped us in, several different areas.
As a CEO, whenever I encounter challenges that feel overwhelming, or too big, I generally, my approach is you bring in the experts, you get help, and oftentimes that help comes externally, and that's exactly what we did in this situation. But you can't ignore it and put your head in the sand. You've really got to act and get support when you need it.
Great. Thank you both so much for sharing your expertise today and your RCM story. Thank you to Sean and Julie for also joining. We really appreciate everyone's time. And thank you to our panelists and our participants for participating. I hope everyone has a great rest of your day, and we hope to hear from you all soon. Thank you. Bye.